In 1960, less than 10% of childhood cancer patients survived. And now we can tell a family with absolute certainty that 85% of kids diagnosed before the age of 21 survive. And, I'm inspired every day by our field. Hi, I'm Tara Henderson. I'm a pediatric oncologist and chair of pediatrics at Lurie Children's. In pediatric oncology, I have two areas that I focus on. I take care of all long-term survivors of childhood, adolescent, and young adult cancer. So I follow them long-term to understand what their health outcomes are associated with their prior cancer and their therapies. And I also am a lymphoma specialist. So I have an interest in caring for children, adolescents, and young adults with Hodgkin lymphoma. Some of my research ideas come from working with my wonderful patient population. It's really a privilege to have that full circle as a clinician and a researcher. So taking care of childhood cancer is really a multidisciplinary team approach. The depth and teams that are here at Lurie Children's really ensures that we're going to have the best outcomes. And as these patients age and become long-term cancer survivors, we have the outstanding partnership with the Northwestern Medical System, where there's also subspecialists that we can pair for both clinical care and future research. So I am a health outcomes and health services researcher. I have a particular focus in understanding a survivor's risk of developing another cancer. And so we've been able to develop guidelines for these patients so that both primary care doctors and long-term follow-up clinics can know these are things to keep an eye on. Here are interventions that you can do. And it has burgeoned a whole field of research where we seek to improve those long-term outcomes. It's really wonderful for me to see that when you do research and when you publish those papers, you're able to impact even beyond your clinic. You're impacting North America and the world. It's really inspiring to me, and I hope that in my love of doing that I can inspire the next generation of medical students and residents to think about a career as a physician scientist. Every child deserves to be cured of a chronic illness, of a cancer diagnosis, of a severe injury. We have the ability to make sure we can have these children go on to live healthy, long, productive lives. And I think that given the minds that are here at Lurie Children's Hospital, we have the ability to really impact that long term.